as a researcher, I'm skeptic by nature, as are a lot of clinicians. How do you approach and what would you tell your peers about not knowing certain things of the MOA, of the super patch in this instance, and that are unexplainable? Obviously, there are things that we don't know in the area, especially in brain research. We're always finding out. What's your experience, and how do you share with them what you know and what you don't know?
Yeah, that can actually be a challenge because there's no medicine in it. What do you mean? That's the first thing people are looking for. And patients don't, you can't feel other than you're wearing, sometimes you forget you're wearing the Band-Aid. I've got 2 of these on right now. I don't feel them. But your demeanor does change if you're wearing one for stress. If you struggle a little bit balance, all of a sudden you have more balance. So that is a very subjective thing. When you get to the objectivity of it, it is helpful to use prior research in the medical literature, which corroborates the function without knowing that they're talking about super patch. Whether it is a paper that says you can stimulate the sympathetic nervous system voluntarily to lower your immune system to fight autoimmune diseases. That is a paper that was written 3 or 4 years before this concept ever came up. Yet we know by using these patches you can tap into the autonomic nervous system to affect a physiologic change. So it's sometimes easier to use existing literature as a corroboration and then your clinical observation of what is occurring. There are a lot of medicines that we use that we don't know how they work, and we just know that they do work. We use a lot of off-label mechanisms in ways that we don't really understand how they work. So I think when I approach the treatment of patients using something like this where research is still ongoing, we've got studies still going on, it is helpful to know, I know from a scientific standpoint that this is definitely possible. I know from a clinical observation, I'm seeing the effect of this occurring, and maybe I don't know exactly what's happening, but I can kind of put the pieces together that I believe it is happening in the way that was described by somebody else for a totally different issue.